Hi, hello, welcome back to another session of one question a day and welcome to this channel. The question that we are going to discuss today is in the salivary gland chapter, important question, intercalated duct, often repeated in exams. To begin with the answer, classify the ducts of the salivary gland as intralobular within the lobule of the salivary gland, where we have intercalated ducts and striated ducts, and the interlobular, between the lobules, we have the excretory duct structures. Intercalated ducts belongs to the intralobular ductal system. They help in carrying or secreting saliva within the lobes of the salivary gland. This is the diagram representing the seromucous gland, where coelomic and striated ducts where happens within the lobules. And this is the area where intercalated ducts would be found. The saliva secreted by the acinar first enters the intercalated duct, point number 1, and transports the saliva to the secretory duct. They are also called as intercalated duct or ducts of Bol. They also contain few myoepithelial cells. The histology will go like this. The cells of the intercalated ducts are low cuboidal cells The cell consists of a nucleus which is more away from the basement or center nearly towards the acinar end. They also contains a lot of rough endoplasmic reticulum, Golgi apparatus, secretory granules or the zymogel granules. They modify the saliva. How? They add about lysozymes and lactoferrins into the saliva. As you might know, these are the components that are contributing to the defense systems of the saliva. Per se, they do not modify the inorganic ions such as or actively resorb or secrete potassium, chlorides, or calcium ions, but are concerned with adding up with the lysozyme and lactoferrin. Clinical significance in xerostomia or dry mouth due to lack of saliva due to and may predisposed to salivary stones and ducts. What will happen if intercalated ducts are affected means there will be a lot of or differentiation in lysozyme or lactoferrin concentration. There is a lot of tumor that could arise from intercalated duct, salivary gland tumors that could arise from the intercalated duct. So they also could predispose to tumor formation. In that condition, the lysozyme and lactoferrins will be slightly elevated. That is the clinical significance. This is the end. You have to draw a neat diagram of the intercalated duct and its presence in the salivary ductal system. Okay, happy learning and stay connected with this channel for learning more. Learn incrementally, at least one question a day. Happy learning.